Hello, my name is Mercy Maclean. I'm a Chartered Health Psychologist registered with the Health and Care Professional Council. I am also registered with the British Psychological Society. I specialise in mental health with over 20 years experience in mental health. I also a behavioural health specialist for both healthcare practitioners and mental health patients as well. It's about looking after people with mental health. It's about the changing needs that people have. So therefore, it's important that we continue to provide the services that people need, because it is also to give them confidence, to raise aspirations, to raise their hopes, and making sure that we are reaching people through inclusivity, diversity, and equal opportunities as well. It's about giving people the confidence to be able to deal with their own mental health, which allows them to access support that is available to them. Again, one of the things that I would like to talk about is men's mental health. We are facilitating that because it is very difficult for men to talk about their mental health, and we would like to engage men to join the conversation because of the masculinity and the roles that have been carved for men. They're not allowed to show emotions. They're not allowed to engage with their own behaviors. They're not allowed to engage, in terms of speaking out, because they are labeled with all sorts of things, which is so wrong. So again, it's about bringing men to the table to join in on the conversation, to be able to talk about their mental health. Mental health is a hidden disease, is a hidden illness that people feel so stigmatized about it that they're not able to talk about. So how we can help people to reach out is that all you need to do is just to pick up the phone, and all information will be treated in the strictest confidentiality. It would not be made public. The first step is to make the contact, because nobody can find you unless you make the contact. And once you make the contact, we will be able to engage with you quietly in your own home, on the phone, wherever you choose to be. The key is to talk. It is very important to speak. You have to speak out, not in public, but in any way that you feel necessary to do so. By speaking, we can bring people like you together in a group, and the key would be that you would know that you are not alone. Yes, it's a hidden illness, but you're not alone. There are people like you which you can bounce off from and receive the support that you need. But the key is to talk. How people will be able to resolve the issues. The first is that you are the only person who knows exactly what the problems are. So what we can do is to help you identify what the problem is. We will take you through and be able to assess you in terms of what is it that's stressing you out? What is making you unhappy? What is causing you the most pain? It is possible that you may have not even identified it, but the answer lies within yourself. So by helping you to assess what the situation is, being able to identify what is making you unhappy, what is making you stressed out, we can help you identify those issues at a point where you recognize the triggers. So therefore facilitating intervention programs for you to recognize what the triggers are. So therefore that would help you that again, you will be able to know what they are, because oftentimes when you're dealing with issues, you're not really paying attention to what the triggers are. So it's important to have support in identification of what they are, so that we will be able to facilitate. It's not about us giving you instructions as to what to do, but it's about working with you to be able to identify what those triggers are and how we can support you to be able to manage those conditions. Our platform allows a global accessibility. Some countries, yes, are more accepting. Some feed that through the church. They would say you're a demon. They don't understand. And what people don't understand confuses them. And for the fact that you're not able, and sometimes it is possible that you're not even able to talk to people within your community because of stigmatization. They might think there's something wrong with you, and let's be honest, what people don't understand confuses them. So you can access us on the web, you can access us anywhere, and we will give you one-on-one private confidentiality to be able to speak with you. Again, identifying, it's about talking. What is the problem? What is the issue? What are the triggers? What is causing you to feel the way you are? Once you open up, it would help you access the support and the help within yourself, and we would help you do that.